So first, before starting, I'd like to apologize because there is quite a long set of slides, so I hope you are not going to be seasick from it. I tried to be as quick as possible. As Paolo indicated, we are all looking forward for a very interactive discussion. So, but please take it also as maybe you will circulate the slide deck afterwards, and it can be also some reference for you, I hope. So I'm again very glad to share with you the, let's say, French experience. The title of the roundtable was about opportunities and risk. Please let me also share with you the fact that I believe that digital health is more about opportunities. It doesn't prevent to look at the risk, of course, and it's part of our responsibility. And as a teacher of, as a professor of risk management at Paris La Sorbonne, I wouldn't hide this part of the story. However, we are just at the beginning of a, I hope, beneficial story for the patient and the healthcare professional. And the most important thing for us is to ensure that they do access those innovations and tools. And our role as Ministry of Health is to put in place the right framework to ensure that they get to that. And there is still a lot to do. So I will articulate my presentation in 3 points, and I hope I'm going to check for the time also at the same time, because I'm afraid that I'll be too long otherwise. So this is the landscape in France. I will not comment and go into the details, but just to tell you that like in many other countries, the landscape is quite complex. So when implementing digital health, and I'm very happy that my colleagues from Portugal are here, because we used to share a lot of our concerns in implementing digital health. So the fact that we have a lot of stakeholders is also, you know, a very important fact to take into consideration, with the regional layers, but also the professional layers, I would say, or sometimes silos. It's part of the context which makes things a bit difficult. The Digital Health Delegation of the French Ministry of Health was only created back now 5 years ago, which is nothing. I mean, we were starting from a point 5 years ago where, I mean, we were so late about digital health. We were lagging behind most countries in Europe. And so the first roadmap that we put in place from 2019 up to 2022 was about to put in place the basic tools and services. And it was more about the tools and technical requirements. I have to say, frankly, the first thing was to tackle the governance issue, because, as I said, with a complex context, we had to ensure that we had the governance in our hands. So it was about taking back the reins and ensuring a smooth implementation of our projects. So that was the first main plan. And I have to say, frankly, I joined in the middle of that, but we achieved every single action articulated around the 5 main orientations. So that was quite a success, and the idea was to take small steps and put the confidence in the mind of people that digital health was useful and was worth the journey. So now we have switched to a second roadmap, which is more about delivering services to the citizen and healthcare provider. Now the tools are in place, and we can elaborate deeper. So the role that we see as a state is, as national authority, is represented in a house. It means that we are going to provide the framework, but it's up to the private sectors and all stakeholders also to take their role in implementing digital health. So, for instance, we are going to ensure we build the roads, we give the size of the pipes to bring electricity or water. So this is the comparison that we take from setting up a house, but the architecture and the way the house is being framed is up to the users. So our new roadmap has 4 axes, which are about prevention, for instance, and simplifying the life of healthcare professionals. I won't go into the details. You have the links if you want to get into more details, but you see the philosophy behind this. As I said, it's part of a long journey that we've put in place with several initiatives, and it was based on the lessons learned from the major failures we had in the past. Because now we can say frankly that it's a success, but in the past we went from failure to failure. So that's the reason why also we took the approach of small steps. One of the key success, and I would say improvement for the patient, is that now the patient has access to its own e-health records. So it's quite new because it was implemented back in 2022, and we are now moving to developing the same kind of tools for the healthcare professional. We believe that a single point of contact for all digital health tools is what makes life more easy and helps quite a lot in daily life. So what was the problem before is that to give access to e-health records, you need to have e-health records, and we had one of the main failure was that we had put, sorry, I don't know what's happening. Okay, we had a system of a national repository for sharing e-health records, but there was no e-health record because there was a lack of software interoperability, and so the software were not feeding, in fact, the national repository. And because there was no feeding of e-health record, there was no use, of course, and we had to break this vicious circle. Now we have moved to a system called the My Health Space, Mon Espace Santé in French, where so we have broadened basically the scope of the initial project of sharing e-health record, and one of the key elements was to ensure the automatic creation of the e-health record and automatic feeding. It's more than a repository because there are 4 parts in Mon Espace Santé, My Health Space: the access to medical records, but also a combined agenda for medical appointments, because there are various market solutions, and the patient needs one single point of contact for its agenda. Another thing was also to prevent the risk of sharing sensitive data via, let's say, well-known messaging system, and put in place a secured messaging system between the patient and healthcare professionals, with one rule is that only the healthcare professional can initiate the conversation, otherwise patients tend to spam their healthcare professionals. So that was also something that we discussed quite extensively with the healthcare professionals. And another thing was also to give a very smooth access to a selected catalog of services. I mean, an app store dedicated for health. You know that there are plenty of flourishing solutions and apps for healthcare, but the patient get lost. So we had to also put a referential in place, combining technical requirements, purpose requirements, and ethics requirements, and I will come back to that. So now we have less than 2% of the citizens which have refused so far to get that solution. We are now at a path of more than 10 million users, so we have close to 70 million inhabitants. So in 2 years' time, we believe it's not too bad, and a lot of very nice KPI, including high speed of feeding of documents. We came from 0 to more than 2,050 million documents a year, and this rate is increasing over time. So it changes life of user and healthcare professional, and I'm going quite quickly, but the idea is also that we have been successfully implementing this with also huge European funding that have allowed us to provide some financial incentive to software providers and to users to use the right version of the software. So this is providing by healthcare profession the interoperability that was lacking before. In parallel, we are also in charge of a cross-ministerial acceleration strategy for digital health, and this is also a very huge initiative that works basically on several topics, like data warehouses for hospital, but also skills and providing access for AI solution in the next steps. So it's about education, research, data, and also clinical evaluation in a nutshell. That was made possible because we took the approach of co-construction, and this is also a golden rule for providing risk prevention of risk, I would say, in the implementation and in the use of tools. Linked to that, we have, I did not refer to that, but since our first roadmap, one of the key pillars has been ethics. And playing on the ethics, and I'm sure that David will articulate much more than I will do on that, is key to also ensure that we are on the right track and prevent the risk to rise. We had several key time in the roadmap of the deployment of ethics in France for digital health. One of them that I treasure is also the adoption at European level of the European ethical principle for digital health that was done during the French presidency in February 2022. Up to the digital health ethics framework that was published most recently in December 2023. So why ethics? It goes back to the very essence of the healthcare professionals, I would say, framework with what Hippocrates said, and that the healthcare professionals do respect in the profession, and it also stresses the very essential parts of ethics that we still have now, like the respect of the privacy of patients. So it's linked to that, but we have also to articulate it with the digital ethics that are also important. And you know that the European Commission has also done a very important initiative about digital ethics. So we have to combine both and ensure that we have solutions that are easy to use, accessible, and at the service of the user, and more than that, sustainable, because we cannot hamper health by developing digital health. So I have to accelerate, but some, so that means we translate that in very concrete action, like I refer to the selection of apps for the store that we are implementing in Mon Espace Santé. That means that we have ethics requirements about transparency, accessibility, and so on. We have also recommendation for the design of AI solution, and David is one of the key person in this journey. We have also the eco-design and sustainability of solutions, as I said. And one of the most recent initiatives, and we see already the value of it, is to have an ethical vigilance platform, meaning that on an anonymous basis, people can go to the platform and indicate their incidents that are hitting their ethics, the ethics in general. So this is the most recent initiative, and I'm quite sure that it's quite unique worldwide to have such an ethical vigilance platform for digital health. So last thing and not least, we are also in a European journey now because we are in the last days of the most important regulation that will have a strong impact on all the entire ecosystem of digital health, which is the European Health Data Space. This is a regulation that will make a project that is already being implemented by Portugal and France, among other 13 countries already. But this regulation will make the system mandatory and ensure the sharing and the continuity of care throughout Europe. And also in the regulation, it's foreseen that we will have the opportunity to have the other countries, third countries, being connected or institution. It will also create the scale for secondary use of data at European level, and that's the reason why it was so important also to prevent any risk in terms of ethics by adopting the ethical principles. It's part of the strategy of Europe to gain sovereignty on data. So the European Health Data Space is the first of a series of 11 data spaces by sector that will be implemented over time. And as I said, the implementation is taking place right now. And to give you a very simple example, by 2026, for instance, in France, but it's already live in Portugal, we will be in a position to use our national e-prescription in all connected countries in Europe, and European citizens coming to France will be able also to get their medicines in any France pharmacist. So that's very concrete services for the citizen and healthcare professionals. So it's a very huge transformation that will affect citizens, healthcare professionals, but also software providers and national authorities, because we are going to create the European scale and also giving back the governance, at least to a certain point, to the European level. So thank you very much, but I hope that it illustrates how we can prevent risk on that.
Thank you very much, Isabelle.